Welcome to the Sandwich Crunch, where we navigate the trends and issues impacting boomers and seniors in the home, the community, and the workplace. I'm Bonnie Kuhn, your host, and I'm excited to once again invite Debbie Shelly as our guest tonight. She is the program manager for the health insurance. It's a counseling and advocacy program with Area 12.
Correct.
And in our last discussion, we were talking about Medicare A and B and the complexities of Medicare and the need for signing up when you're 65 and not intermixing the dates with Social Security and not intermixing Medicare with Medi-Cal. But now we're going to talk a little bit more about the other aspects of Medicare, because we also dived into a little bit of Medicare A and B before, and now we're going to talk about Medicare C and D and various misconceptions that people have overall about Medicare.
Okay.
So I thought you could explain, what is Medicare C?
Medicare C is a Medicare Advantage plan. It encompasses their Medicare A and B, and in most cases, their prescription drug plan, their Part D. Medicare Advantage plans are not, there's not a contract between the doctor and Medicare when it's a Medicare Advantage plan. The contract is between the HMO, PPO, name of the plan, and the doctor.
Okay.
Medicare Advantage plans can offer extra spiffs in their plans. Sometimes they have dental, and say have small dental and small vision.
Or extra goodies?
Extra goodies to get people to want to join.
Okay.
So that Medicare does not cover, because Medicare does not cover dental or hearing. So
yes, I didn't get asked that last time. So I have a question. Does every county offer Medicare Advantage plans?
No. In our 5 counties, no. I don't know about other counties. Most other counties, rural, less, urban, more. Tuolumne County has none. Calaveras has 2. Alpine, I think, has access to like...
They have 2 also.
The 2?
Yeah, I did some research on that.
Well,
so
you know, when it first came out, Alpine had 250 beneficiaries and 36 choices.
Wow.
Yeah.
A little offsetting there.
A little offsetting, exactly. So, yes, and Mariposa has no Medicare Advantage plans. Medicare Advantage plans are HMOs, PPOs, or private fee-for-services. And private fee-for-services are Medicare Advantage plans, but there is no contract between the doctor and the insurance company. It is issue by, visit by visit. So Mama Joe goes to the doctor and says, I have this private fee-for-service Medicare Advantage plan, will you take it? He looks at it, says, okay, I'll take it this time. But the next time you go, he doesn't have to take it. He'll say, Mama Joe, I'll see you, but I'm not taking your insurance. You pay me, and you turn in a claim, which can be quite costly for people if that were to happen. Now,
you do work with people in making or helping them gather claims and to actually adjust claims, don't you?
If they've had a claim denied, yes, we look to see what the reasons were and help them appeal it. Yes.
Okay, and that's quite a process.
Yes, most of the times it is in our area, it has been mostly a coding issue.
Okay.
Or the client didn't understand how their supplement worked with Medicare. They had their Part B deductible wasn't covered, or they have a $20 copay that is on their supplement. They didn't understand that. So sometimes it comes down to just re-educating them on what coverage they do have and how it works. But most of the time it has been a coding issue.
Okay, so I'm a little confused as to why we, as we are rural counties, have fewer Advantage programs, because that's a nice gap. It's a nice bridge for most people that have Medicare to cover other supplementary medical issues or medical coverage that they want, that now if we don't have it in, say, Tuolumne County, which you don't, what other options do you have? They
have original Medicare, and they have the option of purchasing a supplement or a Medigap to go with that if they choose to. They do not, Medigaps are not mandatory, they are an option, but they do cost. So they have that option.
So what's the difference between Medigap and Medicare Advantage?
A Medigap follows original Medicare.
Okay.
So if you have original Medicare A and B, and you go to the doctor and you have, let's say, the F plan, which is kind of like I call the Cadillac. It covers your deductibles and copays for all of your services. You walk in, you walk out, and you would have no bill. But if you only have original Medicare and you had a hospital stay, you're going to owe your first night stay, which I believe is $1,811.
And that's going to change every year.
And that changes every year.
So none of these
So,
fees stay the same.
None of these figures stay the same at all.
So then with the Medigap or Advantage, can you have both?
No.
Okay.
You cannot have it's against the law to have a Medigap with a supplement.
Oh, interesting.
Sorry.
Okay.
It's against the law to have a Medigap or supplement with a Medicare Advantage plan.
Okay.
You cannot. Medicare Advantage plan is it's in its entirety. That is it. Medicare is paying that insurance company. Let's just whatever company it is, they're paying that company to take care of you.
Like HealthNet or Blue Cross or
Yes.
whoever that might be.
They're paying them to take care of you. They're paying them a capitation rate. So anywhere from $400 to $700 a month, they're paying that company to take care of you, whether you go to the doctors or not. So they get that money.
Okay.
So if you never go to the doctor and you belong to a Medicare Advantage plan, they're still getting paid. So that's why no bills will go to Medicare. Medicare will send them straight back denied because they have to go to the Medicare Advantage plan.
Okay, so that's a really valuable piece of information because I know that my dad has Medigap and that he has Medicare A, B, and D, and obviously the Medicap. And my mom was in the hospital in 2012 for 1 month in Modesto, and it cost $1 million.
Holy moly.
Yes, that's what I said. Holy moly was probably the understatement of the world. But reviewing all that, Medicare covered everything because of his Medigap coverage and all the things that he followed suit with what needed to be done.
Right.
And everything was covered.
Medicare's basis is medical necessity.
And it absolutely astounded me how expensive it was.
Yep.
Wow.
Now, what Medicare gets billed for and what Medicare pays is between the hospital and Medicare. They all have their own rates, and they have what they call bundles and packages. But Medicare will sort that out with the hospital. But the bill you saw is what they billed for. Doesn't mean that's what they paid. They might have even paid more.
Oh, wow. It's just very astounding. Insurance is, well, that brings up a very, very delicate point because we have a lot of seniors that can't afford health care.
Correct.
And they need to be on Medicare, and they can't even afford some of the supplements on there. How is that dealt with Medicare?
Medicare doesn't deal with it. If a client comes into us and says they can't afford their supplement or they can't afford to purchase a supplement, we start prodding for their income to see if they're eligible for those Medicare savings programs that we talked about. We also talk to them about Medi-Cal. If their income is low enough, we would suggest they apply for Medi-Cal. We don't do the eligibility and we don't do the application for Medi-Cal, but we definitely can help them and guide them as to how Medi-Cal can assist them. There's 83 different ways to get on Medi-Cal.
Well,
yeah.
We don't need to go there.
Yeah,
That's a whole other concept.
So, I mean, there's a lot of ways that sometimes people can make it onto Medi-Cal.
Without going destitute.
With it, yes.
Well, there's another thing with Medicare D, Plan D. It's my understanding that Medicare Plan D is the drug coverage.
Yep.
And that under any other plan, you may not get drug coverage. You strictly can get drug coverage only under Plan D if you have Medicare A and B.
If you have original Medicare, you're going to have original Medicare that includes A and B, and then you would have to purchase a Part D. If you have a Medicare Advantage plan, 90% of the time, the D comes with that.
Okay.
So you don't purchase a separate one there.
Now, if you get a Medigap, you cannot get a drug policy with the Medigap.
Medigaps cannot have drug coverage.
That's okay,
now,
that's what I
having
thought.
said that, there are some old grandfather clauses still out there that do have drug coverage on them. And,
Okay.
you know, those people, if they get rid of those policy or upgrade or downgrade, they will be subject to the penalty. Yeah, the 1% penalty that went back to 2006. So they're not going to get rid of those policies. They're at probably 96% penalty at this point if they were to change. So
This sounds confusing to you. This is confusing to me. So I really recommend that you pay strong attention to your Medicare and you meet with a professional on your Medicare needs. Really, Debbie, this is just astounding. One of the interesting factors that I have found, because I knew this was not true, but consistently I hear it over and over and over again, because we have a lot of seniors who are looking at, what's going to happen in the long run? Am I going to need long-term care? And am I going to need to live in a facility? Am I going to need to be in an assisted facility? And I know Medicare doesn't cover it, but I want you to explain why it doesn't cover it and what Medicare actually does cover for long-term, quote, long-term care, and what does that mean within Medicare?
Under Medicare, Medicare does not cover custodial care, period.
And custodial care is?
The custodial care would be non-rehabilitative care.
So like someone coming in to like a live-in assistant.
I mean, somebody could go to the local rehabilitative center, Avalon, that's one I know off the top of my head. They go in under rehab. They are trying to get rehab. They do their 100 days or 20 days, and it's just not working for them. And they decide that they need to stay. They've gone, and they will go from, in the same bed, from rehab to custodial care. And Medicare does not pay for custodial care. They will pay for the care of that person while they're receiving rehab. Medicare does not pay for custodial care. Bathing, washing, feeding, those kind of things are custodial care. Rehab so they can get home, yes. When they go home, rehab, yes. Home health, yes, but not custodial care.
But only for a certain period of time.
Yes, home health and physical therapy there's caps on them, but only unless the facility does the disclaimer and gets more care for that person.
Okay, now I know you also cover hospice care.
Medicare does cover hospice, yes.
Okay, and then when someone goes in to Medicare and they are on a longer term stay, it's my understanding that if you're in a hospital and you've met that 3 midnight minimum,
Yep.
and that you're in the hospital for a certain period of time and you're released, and you are now out of the hospital for so many days, and you return again, your numbers start recounting. Is that correct?
Well, if you're in the hospital, the day you enter the hospital for 60 days with no other services is called a spell of illness. So Mama Jo goes in with a broken hip, she's in the hospital for 4 or 5 days, she goes to rehab for a week, goes home for a week, and then she gets pneumonia severe and ends up back in the hospital. She's within her 60 days. Her first night stay is covered because she's within that 60 days.
Okay.
A spell of illness does not have to be for the same illness or the same ailment, but it would be covered. If it was day 61, yes, she goes back to the hospital, her deductible would be due again either from her or the insurance company.
Okay, so again, this means a lot of clarification.
A lot of clarification.
Are hospitals good at clarifying this when they are meeting with their patients?
It depends on how much they know.
And if it's a puzzle and it's changing all the time?
They will call us.
Okay, good.
I mean, I will say that the hospital discharge planners, and they're very good about calling us to see what and most of the discharge planners and the doctors know what Medicare will cover.
Okay.
I will say that they're pretty good about that. Where clients run into problems is if they've been in the hospital, they've stayed 3 nights, but they were never admitted. That is when they run into problems.
Now clarify that, because how can you be in the hospital for 3 nights and not having been admitted?
You're under observation.
Oh, interesting.
Observation is not an admittance. You're not admitted into the hospital. You're under Part B, co-pays, deductibles, everything. Not Part A. You're under Part B when you're under observation status. And you could be in there. We've had clients, not in this hospital locally, but within our network, 7, 8 days under observation. Then they are sent to the rehab thinking they're fine, but they're not. Medicare doesn't cover it if you're under rehab, under observation.
So,
Medicare will cover it under Medicare Part B, but your nights stay in the hospitals are not admitted. So therefore, your rehab is not covered by Medicare. It's up to the client to advocate and make sure that they were admitted.
So this is where patient advocate is a really good person to have.
Or family member. Somebody needs to say, hey, I mean, it happened with our staff member. Her husband was in and he wasn't admitted. She said, you admit him. But she knew. She knew to ask.
I can guarantee you, probably 90% of that audience, our audience does not know that. I didn't know that.
Well, it hasn't been. It's all over the news now. Medicare is doing. I'm not Medicare. Congress is having meetings on it, and they're bringing it to because it's become such an issue of observation. So there's talk of revamping Medicare and how they're going to do that in regards to the 3-night stay and observation. We'll see. Because hospitals are given bonuses for non-readmits. So if you're under observation, you're not considered a readmit if you do come back.
So this comes down to finances and
Yes.
bottom line finances.
Yes.
Interesting. This is very convoluted and
Yeah.
very.
Oh, and it gets even more so with the changes within the hospitals and how they're allowing admitting to be done. But that's hospital to hospital, so it's case by case again.
So you could go to one hospital, they'll admit you, and the other hospital will put you under observation.
One hospital will allow your doctor to send the admit, and some hospitals say no. Our hospitalist has to say you're worthy of being admitted, or needing of admitted, not worthy, but needing of admittance.
Well, that's one thing I want to clarify too for the audience, because I am aware of what a hospital is, and I think that's a new concept for
Yes.
a lot of people, and they don't realize what it is.
It's very new up here too.
And they do have it at Sonora Regional,
Yes.
and I believe we have it at Mark Twain. I can't speak on behalf, but I believe I've been told that they have it there. But it is the on-staff doctor that manages a certain number of cases on that floor. So, or
Usually it's in the ER.
in the ER, or like for my mom, she was in the cardiac department. So that we had an on-site doctor, and he or she is the person you need to be connecting with,
Right.
and getting information.
Correct.
Okay.
Because that's the one that's going to say yay or nay, you're admitted or not.
And in my experience, be a squeaky wheel, and
Yes.
don't say no for an answer, and don't think, because there's so many patients in there that they're taking care of, that if you're not the squeaky wheel, you're not going to be getting the attention that
No.
you need. So
you won't
really,
get your answers.
No, and you need to be really actually
Diligent, and
yes.
you need to be diligent. It's your life.
It's your life, exactly. And I know I had to do that for my mom when she
I had to
was
do it
done.
for my dad.
Isn't that, it's just
Yeah.
very frustrating, but have a little bit of knowledge is better than none at all.
Oh, I mean, yes, none at all is dangerous. Too much is dangerous. But I mean, my father was admitted to the hospital, or he wasn't admitted, and same thing happened. You know, I'm like, hey, wait a minute, he's had a stroke. They're like, oh, well, we'll take care of it right now. And they did, but I mean, I would have fought it. I could have fought it. There was no problem. But it's just one of those things that people don't think to ask, because their loved one is in a bed, in a room, getting care from a nurse and a doctor. You assume that they're admitted. You cannot assume that anymore.
Okay, all of you need to meet with Debbie or contact Debbie at Hicap, because you are a invaluable source of information, and you love this puzzle.
I love it.
That's just what amazes me. Insurance is not something that like makes me go woohoo.
I think it's
just
the
one of those.
mixture, and it's the human. If I was doing insurance, it's one thing, but I have the human contact. I get to deal with each person's individual needs and requirements, and so that gives it a personal touch, I guess.
Well, that is a really wonderful thing to do. Now, the thing we talked about, the long-term care, and I do really want to make sure people are extremely clear on long-term care, that Medicare is not long-term care insurance.
No, it is not.
And custodial means the daily needs.
Daily needs,
Whether
yes.
someone needs to be fed, they need to be dressed, you need to help them with toiletry, you need to help them
Bathing,
with bathing.
anything.
That is not covered under Medicare.
No.
That is Medi-Cal or long-term care insurance.
Correct.
Okay.
Or private insurance.
Or private insurance, or some other viatical that you have that you can use
Yes.
as a financial resource.
Yes.
Okay, because I know that so many people I have talked to that are my age say, well, I don't have to worry about getting long-term care insurance.
Well, and then I've had it come to me a couple times when people have brought in their long-term care policies, and they have elimination period or a deductible period of 100 days. And I'm like, do you know that during this 100 days you pay full price? And they said, oh, no. The agent told me that Medicare covers the first 100 days. I said, no, Medicare does not cover long-term care. Medicare covers your rehabilitative care, which could be in the same room, same bed, same facility, but not custodial care. If you're in long-term care, you're under custodial care. So you are going to be paying the first 100 days, which is 3 months and 10 days. You need to make sure you have that $15,000, $20,000 set aside to cover that.
And that's a lot of money, because the rates, as I understand, we're looking at by 2020, 2025, $18,000 to $25,000 a month.
It can definitely get that high depending on level of care.
Yes.
It's all on level of care.
So that's a place where then someone has to be looking at a completely different market, whether it's long-term care, life insurance policies, annuities, and various other aspects in order for them to cover long-term care, which is not what we're talking about today.
No, I mean long-term care policies that people come in with, a lot of them are comprehensive policies, which means it covers them at home, in a facility, assisted living, and long-term care, custodial care. But people need to understand what they have, how it works, and how is it going to cover their need, or is it going to cover their needs, you know?
Yes.
And that's where a lot of people get lost, and they bought it when they were 20 or 30 or 40 years old, and they come in, how do I use this? You know?
When am I supposed to use
Yes,
this?
exactly.
What do I get out of this? I put money into it and I get nothing out of it.
I had a lady come in, she was 90 years old. She goes, I don't need it now, I might need it when I'm old, you know, and she had a comprehensive policy she'd been paying on since she was 40 years old.
Oh, I love it.
You
When
know,
I'm old.
when I'm
Boy,
old.
She's kicking along.
I said, you're never going to need this, sweetie. She goes, oh, yeah, I might, you know, and it's just sweet as can be. But, you know, she has it. She doesn't have any kids. And a lot of people, they have to look at their own situation to figure out if it's something they need or what they want. But
And if they want it.
if they want and can afford it,
Yes.
because it's just like an insurance, they go up.
Oh, yes. Oh, they're very expensive
Very.
policies, especially the longer you wait for those.
Yes.
So as we're talking about all this Medicare A, B, C, and D, what are the top 3 questions that people always ask you?
Oh, wow. The top 3 questions right now would be, do I have to get a covered California policy? We're getting more phone calls about that because it's the last year it was the open enrollment. You have the open enrollment for the rural expansion. You have the coordinated care expansion. You have all these things going on, and people are getting letters, and they're quite confused. But covered California would be one of our big questions. How am I supposed to pay for this? How am I supposed to understand this? Are very big questions because they think that, you know, everything is going to be simple, and it is actually the most complicated time when they go on to Medicare because the options become so innumerable and just scary, overwhelming.
Now, do companies actually do a very good job of preparing a lot of their employees for Medicare, or?
If they
Have you-
offer a policy, if they offer coverage to go along with Medicare, they're not called supplements or employer group health plans. They are very good about sending out letters, and a lot of them do educations. I know a lot of the urban areas, they have Hicap come in and educate the people, especially big companies, people getting ready to go into retirement, and let them know how Medicare is going to work with this policy, that you have what you need or what you don't need. In our area, CalSTRS, CalPERS seem to be
Yes.
2 of the biggest
Oh, 'cause it's all
employer
county.
produced. Right.
Right, all county and state.
County and state. Most of the other big companies don't follow into, once you retire, once you're no longer working, the policies don't follow them into Medicare age. Medicare becomes primary.
So then there's a lot of not miscommunication, but lack of communication then from certain companies for
Well, I
certain-
will say that when somebody calls me and said, I'm getting ready to retire, and I asked, do you have an employer group health coverage? They say yes. I said, is it going to follow you once you go on to Medicare? No, they've let me know. So they do know that it's not going to follow them into Medicare. What they don't know is what the options are. So the ball stops. We're not going to cover you. Now you need to go out and find your own. Pretty much. A lot of them is like that. Not that they wouldn't know what to give them anyways, and to be honest, if they're not covering them.
Well, the question that comes up for me is I'm thinking, you know, gosh, I'm 55, I'll be 65, and I'm not that yet. But, you know, when I'm 65, I'll have to be worried about Medicare. Does Medicare actually send out a notice to every person who's turning 65 and says you need to sign up at this date, or are you just assumed to know that you need to sign up on your 65th birthday?
That is a very good question. If someone is receiving their cash Social Security benefit, their cash benefit, their Medicare will start automatically.
But they could be only 60, they could be 62.
Or 65.
Or 65.
Right. If they get their cash benefit, whether it's a widow's or whatever, they're getting a Social Security benefit, it will start automatically for them.
Okay.
Even if they're on disability, Medicare will start automatically for them.
Okay.
If you're not receiving your cash benefit because you're waiting till the higher dollar, you need to sign up on your own, either online or at Social Security, 3 months before your birthday. The enrollment period is 3 months before, it's a 7-month enrollment period. 3 months before your birthday, the month of your birthday, and you have 3 months after your birthday to sign up.
For Medicare.
For Medicare. You have a 7-month window to sign up for Medicare.
So unless I'm
With
not...
no penalty.
Okay, and so if I'm not receiving Social Security, I don't get a notice in the
No,
mail.
you do not.
So I'm supposed to miraculously remember to sign up for that period of time.
Yes.
How many people show up in your office saying, you know, I just got told by my neighbor Joe, and he said, you know what, you just missed out on signing up for your 65th birthday. You know, you just missed that 7-month period. I know, because I screwed up last year. How many people come into your office saying that?
We've had a few come in that, but it's more or less they didn't want to do it.
Don't want to admit they're 65.
We've had some, you know, that thought that if they waited for their Social Security, that their Medicare would be more too. You know, they thought that they were related, and they're not. Their cash benefits tied to their Medicare, but it's not. So we had that, though we've had quite a few of those come in where they're 67 or 68. Now they have a penalty because they didn't have an employer group coverage. Most people, if they're working or not going to work, they know because they've gotten a letter from their employer or their insurance that says you're turning 65.
So generally, someone is going to contact you.
You're going to get something that's going to hopefully put a light on in your head saying, okay, something's changing here. And maybe
It's like
I
if you
need
have a
to ask
life
some
insurance
questions.
policy, or maybe it's your regular State Farm agent says, you know, by the way, you're 65, you need to do that for you?
Well, the other good thing that happens is you get inundated with mail from all the Medigap companies.
Oh, because they know you're turning
Yes,
65.
they
So
know
that's a
you're
good
turning
sign to
65.
know.
So there's your that is probably the biggest sign you're going to get.
Okay.
All the Medigap companies will start sending you a plethora of mailers, and it'll overwhelm you. I mean, I've seen stacks of people coming in with
Well,
them.
at least there's some notification out there.
I don't know if it's notification or just a fluke.
Well, on that note, what would you like to tell the audience? Is there one last thing you'd like to share?
If you have a question about Medicare, call us, because if we don't know the answer, we will find it for you.
Okay, how can they reach you?
800, they can call us at Area 12 Agency on Aging at 800-434-0222.
Great. And also for my audience, our audience, you can come to Sandwich Crunch and visit bonniekuhn.com and go to the resource page and also find information that will direct you to Debbie and your Hicap agency.
Wonderful.
So Debbie, thank you so much. It's been a pleasure. This is quite a maze to work through.
It is a maze,
Thank you for
definitely.
sharing with us and exploring this puzzle.
Thank you.
And wish you luck with all the 65-year-olds stepping in your doorway.
We have plenty.
All right. Once again, thank you everyone for joining us, and have a wonderful evening. And I'm Bonnie Kuhn with the Sandwich Crunch, navigating the multi-generational trends affecting boomers, seniors in the home, workplace, and community.